All right, we're live.
All right, good morning. It's January 12th. This is the Senate Health and Welfare Committee, and this is our first meeting of the 2021 session. So welcome, everyone. It's so good to see everybody here, although it feels like we never ended. I think September 29th was our last meeting we had, and then through a whole lot of other events. So here we are. You know, because it's the first meeting, and I just want to say to the three new members who are here, we're very pleased that you're here with us. Senator Terenzini, Senator Hooker, and Senator Hardy, and we look forward, I look forward to working with you folks very much and learning about your priorities. So we'll be taking some time today just to introduce ourselves, who we are, and what our interests are. And then we'll also take some time to talk about our Zoom meeting process and how that will work in the committee. And I know that we're going to have Zoom conversations, process conversations, at least in the first part of the session, because it's different now. It was an emergency in March. And I think we all hunkered down and did what we had to do. But now people are more interested from the outside world, the real world of our constituents, to be engaged and involved. And we're going to have to deal with that and how we can keep our meetings transparent and open for folks. So why don't we, what I'd like to do today, and it's pretty introductory, we'll just spend all of our time today on the issues that I've just talked about, and then try to identify what your priorities are so we can put those down as a committee. And just as an update, so we meet on Tuesday after the floor, we meet Wednesday from 9 to 12, we meet Thursday from 9 to 12, and we meet Friday from 9 to 11:15 to get to the floor at 11:30. And so if there's any, that's our regular schedule. Okay. So what I'm going to do is I want to go around the Zoom, around the table, and have our staff introduce themselves first, so we know who they are and what their areas of expertise are, and then we'll go and talk about who we are as senators. And I see Nellie left, so we won't start with. Oh, there she is. Okay, Nellie, I'd like to start with you and just let folks know who you are and what your role is for the committee.
Absolutely. Yeah, I'm Nellie Marvel. I'm the committee staff person for Senate Health and Welfare. This is my second session here with Health and Welfare, and I'm really very pleased to be back. It's my second session with the legislature, period. So yeah, I mean, I handle all of the various kind of back end aspects of these committee meetings, scheduling testimony, making sure that folks have the Zoom invites, getting written testimony posted and into the hands of the senators, everything like that. So, you know, basically if there are any questions or comments from folks either here in this room currently or out there in the YouTube world about how to do things for this committee, come to me and I'll either answer those questions or relay them as appropriate. I live in Montpelier with my husband and my son, and yeah, just really pleased to be here.
Thank you. Jen.
Yes, hi, I'm Jen Carby. I am with the Office of Legislative Counsel. I'm one half of your sort of health and welfare drafting team. Katie's the other half, and you'll hear from her in a few minutes. I handle health insurance, Medicaid, healthcare reform, healthcare delivery and finance issues, long-term care, aging, smoking, sort of, you'll find out more about how who handles what when Katie or I come in to work with you on particular bills or topics. This is my 14th year with the Legislative Council, all working on health and human services issues, and I'm looking forward to working with this kind of newly constituted committee.
Okay, thank you. And Katie, and you're muted. No, you're not.
Good morning, Katie McLinn. As Jen said, I'm the other half of the Healthcare and Human Services team. This is my 10th year with the General Assembly and serving in the Human Services and Health and Welfare Committees. Topics I cover include mental health, public assistance programs, public health, childcare, substance misuse, public benefit programs, and I'm sure there are other issues. Disposition of human remains falls in my bailiwick. So all kinds of topics that fall within Title 18 and Title 33. So I look forward to working with everybody.
Thank you. And Nolan.
Hi there, my name is Nolan Langwell. I am with the Joint Fiscal Office. This is also my 14th session or 7th biennium with the legislature, and I staff health and human services as they pertain to fiscal issues. So I go where the bills go. So I spend a lot of time in this committee. I spend a lot of time in finance. I'll spend a lot of time in appropriations, and the same on the House side as well. I dabbled a little bit, as Senator Hardy will recall, in ag, but that was probably just a slight detour, but mostly in health and human services and finance related issues. And I look forward to working with you all.
Thank you. And I think we all know how indispensable each one of these folks is to us. And then my one word of caution is let's be careful about overworking our ledge council. We know what that's been like with the pandemic, but I'm thrilled actually that Nellie, that you're back in particular, and Jen and Katie and Nolan. I will share with the committee that since I became chair of health and welfare, I've had 4 different committee assistants. So it's nice to have some stability in Nellie's office. That's great. All right, so why don't we go around, and what I'd like for you each to do is each of our senators here, if you don't mind, introduce yourself briefly, and maybe a little bit about what brings you to health and welfare, why you're here, and then some of the issues that have brought you here. I'm not interested at this point in gathering all of the issues that you have. I'd like to sort of set that aside after we've introduced ourselves. But just to introduce yourself and then tell us one thing about you that most other people don't know. So, and we'll start with Senator Cummings because she is the old hand. And you're muted, Senator.
Okay. Yeah. Okay. So with the departure of Senator McCormick, I think I'm the senior person on this committee. And I'm not sure. I think I've been here 6 years, but I'm not sure. I bounced around 1 year for a few weeks. I've been in the Senate for a long time, and I chair finance. I worked on healthcare reform through finance and back through health and welfare, and we find there's a lot of overlap between the committees and the Committee on Appropriations, and trying to make sure that when we send out a bill, it can be financed and paid for and it's ready to go. I have a lot of interest in healthcare reform, the cost of healthcare, where we are right now in that process. So that's who I am. I don't think there's any little known facts about me. I knit.
Oh, come on. There has to be. I mean, you're a knitter. Let's do that one.
I knit. I collect teddy bears. You may see some in the background. Old teddy bears. Very old teddy bears.
I didn't know that. See, that's a new tidbit. Yeah.
Occasionally you'll see some of my old bears in the background. Or there's a rear end of a ride-on one over there shows up.
Okay. So why don't we go to Senator Hooker?
Thank you, Madam Chair. I'm really happy to be here. I came here from Senate Economic Development and Senate Institutions, which were my last two committees. I've been in and out of the legislature over the past 31 years, which is rather scary to think of. But years ago, I was on health and welfare under the chairmanship of Helen Reilly. And I was happy to be there, and I'm really happy to be back. It's like coming full circle. So I'm glad to be here, hoping that my experience on economic development will help with the workforce problem in healthcare so that we can work across committees. And certainly with my new assignment in education, I see that there's going to be a lot of interaction, and half this committee, more than half this committee will also be on education. So we'll have a pretty strong voice in that. So I'm happy to be here, looking forward to getting to work on healthcare issues, a lot of which Senator Cummings has already addressed. One little known fact, I don't know, I'm pretty wide open, I think, pretty transparent. Spent a year, my family spent a year in England. My husband was an exchange teacher, and that really helped to form my views of our own society and world society. So hoping that that helps as well.
Wow, terrific. Thank you. And I didn't know that you spent a year in England. So, and the English healthcare system is so different from ours. So
Absolutely.
yeah, it'll be interesting to hear your thoughts. And so I'm going to go to Josh, Senator Terenzini next.
Well, thank you. First, let me say I'm excited to be here. This is my first official committee meeting as a brand new senator. I do not come to this committee with any big agendas or ideas or concepts, but I hope to bring a voice of common sense and you know, just I want to learn in the first. I think it's important to learn and listen, and you're not going to hear me interrupt a lot and interject my opinions where I don't know what I'm talking about yet. And it's important that I learn from all of you, and I'm excited to be on this committee with so many of you. I think that what we face right now with the recovery of the economy with COVID and healthcare costs are skyrocketing. I think this is going to be an interesting committee for me to help serve on. And like I said, I look forward to doing a lot of listening and learning here in the beginning. Fun fact, I don't know if it's most people know, I guess, if you know me, but my wife, Jessica, and I, we have 4 children. Grace is 8, Kennedy's 5, Liberty is 2.5, and Grant is 4 months old.
Wait, let me get this straight. You have Liberty, Kennedy, Grant, and
Grace.
Those are amazing names, and it sounds like you have a really rich family experience. Are you able to work at home?
For the most part, I am. I still have a full-time job as I balance that and you know, my serving in the Senate, which is good. A lot of people told me that you're absolutely crazy with 4 kids, a full-time job, and then to run for the Senate. But you know, I wish there was an 8th day in the week, but I'm going to make it all work. So.
Well, we're pleased to have you here, and thank you.
Thank
Thanks
you.
for sharing that. And so, and then Senator Hardy, who is vice chair of the committee, and I wanted to save you for last. So Senator, go right ahead.
Thank you, Madam Chair. I'm happy to be here. I'm excited to work with all of you. This is my second term in the Senate. I represent Addison County, and being on this committee, I'm following in very big footsteps in the wake of Senator Claire Ayer, who chaired this committee and served on this committee for a number of years. And I'm very conscious of that fact and need to reach out to her to get her advice for sure. Let me see what brings me to this committee is that we're in the middle of a pandemic, and I think this committee has a big job ahead of it. And I'm excited to dig into that to help our state continue to respond and recover from a pandemic. I have an interest in healthcare access and affordability. I used to be the executive director of the Open Door Clinic here in Middlebury. So access to healthcare for a broad spectrum of our society is really important to me. Let me see, little known facts. The two things that came to my mind, seeing the faces on the screen. So first of all, hearing Cheryl say that her family spent a year in England. My family spent a year in Germany, where my husband was a visiting professor. So I also got a good perspective on their healthcare system. The third week I was there, my daughter, who was at the time in second grade, fell off a teeter-totter and broke her arm, and we ended up in the emergency room. And my very basic German got a good run for its money as I tried to navigate a foreign healthcare system in a language that I didn't know super well yet. But her entire care there for her breaking her arm and having multiple casts and multiple visits was only about $200 compared to what we spend here in the United States. So, and then my second maybe little known fact, I'm going to take two since I'm last, is that I have known Nolan for a number of years. We were in the Vermont Leadership Institute together, and we are both ENTJs. So you can figure out what that is. Thanks.
We know what that is. We know what that is. That's great. All right. Well, I guess I should introduce myself a little bit, and then we'll be off and running. I've been in the Senate. This is my I guess it's my 11th term in the Senate, and I chaired Natural Resources for 10 years, and then I have now changed to chair Health and Welfare. I served on Health and Welfare when I was first in the Senate under Senator Chard, who was really an outstanding healthcare leader. And but I will say that my interest in here is quite diverse and eclectic. I did live in Turkey for a while, and we lived there when there was a cholera epidemic. So that's a little known fact about me. And another little known fact about me is when I was in grad school, and then afterwards, I started a migrant care clinic and facility that today has expanded to cover not just the one town we were in, but now it covers a huge area in New York State. And I'm very proud of that work, among other things. So it's a pleasure to be here with you. We have a lot to do around, obviously, the pandemic, but also, and I hear this from each of you, around healthcare reform and trying to find out what are the next steps. And I know that we've all been concerned about that, and we'll continue to work together on that. I just want to talk a little bit about committee process, and I think we all understand the absolute need to listen during our committee hearings. So when we have testimony, it's key that when someone is speaking, if it triggers something in our minds, that's great. But let's let the folks who are testifying testify and say what they have to say. If there are questions of clarification, of course, we need to move in that direction. and we will do that. It will be important for each of you to recommend topics for consideration to me. And you can filter that through Nellie if you'd like, but pretty much we're going to have a long list of things to do, and everyone's going to want to do something right away, but that isn't always possible. So just let me know what your first priority is, or a priority bill that comes in and you'd like to work on, and let me know. And we'll try to accommodate each person of the committee so we can accomplish your goals. Because these are committee, and they are committee goals. We need to make sure that we work together on that. We are going to meet at 9 o'clock each day. If it looks like we're in a crunch and we have to complete something, we may move that time to 8:30 or 8 o'clock. That's not our favorite thing to do. We know that, but last session, we were very able to get everything done beginning at 9. There were a couple days where we started earlier than that. But so that we'll hold on to that. Zoom, we're gonna have a conversation about Zoom, and I'm gonna let Nellie talk about that in just a minute. My one request of you is please come in ready to talk about the issues that are on our agenda. So for example, or listen, our agenda planning meeting is on Wednesdays at 12:15. And it would be great if Senator Hardy, if you can attend those so that you're up on what we're doing. And then, and Nellie will send a memo out on that. So once we have our agenda in place, then we get started. This week, we are meeting with House Healthcare and House Human Services, both Wednesday and Thursday. So we have the, I like to say we have the lion's share of work, because we have both healthcare and welfare, health and welfare. In the House, those things are sort of split up into two committees, into Human Services, which looks at public health and at human service issues, with some overlap with what healthcare does. The Healthcare Committee in the House looks at healthcare reform, Medicaid, Medicare, and then mental health. And there may be other things, and Katie and Jen will keep us up to speed on what that is. But basically, the two committees are working on bills and issues that we work on independently here in the Senate. The result is that there's a lot of work to do. So one of the things that we have thought about, and my talking with the chairs of those two committees, is that we would begin our work looking at the CRF funding that we have just been through, the policies that we put in place, how those policies are faring, and what things we might want to, where the gaps are. So what things we might want to do going forward. So that will be tomorrow. We'll start with the Public Health, Department of Health, and we won't start that committee meeting. Nellie, what time is it? 10? We start tomorrow?
We have committee discussion starting at 9, and then at 10 we'll go into the joint meeting with the two House committees.
Right. So you'll get a notice for I don't know. Well, that's Nellie's job, not mine. So we'll be and I'm going to let you talk about that in just a minute. But we will we will meet with the two committees tomorrow. The screen is going to be full. And it's going to be very difficult for us to have a full discussion about all the information that we're hearing. It will also be difficult for us to ask all the questions that we'd like to ask. And I know we have them. So when the Department of Health is in, Of course, the questions may gravitate to the vaccination process, the availability of vaccines, the distribution and who's first and second and so on. We will look at that, and we will be able to discuss what we need to know further after that meeting. Unfortunately, the hour we have for discussion tomorrow is before that meeting. We couldn't change it. Department of Health was only able to be in later in the day. So so that's tomorrow, and then on Thursday we will be looking at some of the other issues related to the CRF funding. So the Healthcare Stabilization Fund, that's the fund that was available for various providers, and how that money has been allocated, distributed, and what, if any, needs and gaps have existed, how much money is left over, and whether or not we're going to be able to make decisions about some of the policies related to that. We'll also be looking at the designated agencies and others. So within the framework of the 2020 CRF money, or the Coronavirus Relief Fund money. So Josh, if I start using acronyms that are uncomfortable, you just let us know, and then we will have a chance. We will take some time early in the session to do a quick overview of our sort of responsibility, and then look at some of the acronyms that exist in our world. And I know, Jen, you had a list of acronyms at one point. Yeah.
I think that's Nolan. I'm pointing
Nolan. Oh, good. All right. Well, we might come back to resurrecting that at some point. Okay, so that's just some general information. I just wanted to prep you up for Wednesday and Thursday, because it's going to be there'll be a lot of people on in that meeting, and we each have very specific and directed questions that we would like to have answered. So we'll listen to see if they are answered. If they're not, we'll make sure that we can get someone in who can answer the questions that we have. How's that sound? Okay. All right. Okay, good. So, and I don't want to take up the time talking about the meetings that are coming, but I do want to give Nellie, and we do want to have a chance just to talk about Zoom process, and then let's talk Zoom a little bit, and then let's list some of your priorities, if we could do that. Well, why don't we start with that? Zoom will be maturing as we go through the session, and I think being aware of hand raising and being aware of listening is going to be pretty important. So, Nellie, would you like to start our conversation on Zoom? And then we can all just, it'll be as if, let's sit around the table and talk Zoom for a little while, and we'll we'll get to where we need to go.
Absolutely. Yeah, so we're all in this brave new world that is Zoom, and as Senator Lyons noted, it is ever evolving, and I will do my best to keep everyone abreast of things. But so Senator Lyons noted being conscious of raising one's hand. You can obviously just like raise your hand on screen like that, but Zoom also has a function where you can like digitally raise your hand, and that's in, if you have the most recent version of Zoom, that's under reactions. If it's not there, that's also, it might be under participants as well. So you can sort of digitally raise your hand as well, and you'll have a little icon that shows up on your in your speaker window that both Senator Lyons and myself will be able to see. Yes, see, Senator Lyons just raised her hand. It'll stay up there until you lower your hands. You don't have to be so conscious of just like holding your hand up there yourself. So that's a really useful thing. You can also, there's a few other functions in there as well. Under reactions, you can say yes to something without unmuting yourself, no to something, ask to go slower, ask to go faster, for witnesses giving information. And that can all be useful. So I see Senator Terenzini has his hand raised. Are you just demonstrating?
No, I was just looking for the button. I must have hit it.
There you go. Well, I can also, you found it. I can also, I can lower your hand as well, if.
Yes, please do.
No worries. I think you can also lower your own hand as well, but it's a useful function. A couple other just quick little Senator Hooker, are you just demonstrating?
No, I do have a question.
Okay.
When someone else raises their hands, I don't see it. So do we only see our own hand when it's raised?
So go ahead, Senator Lyons.
Well, I'm going to raise my hand. Can you see my hand?
No.
Huh.
So I believe that's because only the host and the co-hosts can see raised hands. So since I'm the one that set up this meeting, I am the host, and then I always make Senator Lyons the co-host of the meeting as well. So she can see raised hands, and she can call on folks as needed and as she sees fit. So she can kind of like control the queue there as well.
It may be a function of the age of my Zoom account.
Yeah, I can see everybody's raised hand. Like Nolan
there you
has his hand raised, and I could see Cheryl's and Josh's as well.
Okay, so it might be a version of Zoom thing.
But also, if you go to participants, it'll create a side screen, and you can see everybody whose hands are raised also, and who's
okay, I can see that.
Summary.
I'm just going to say, raise your hand if you can see the hand raised. Sorry.
I can see it on the participants list. I don't see it on the screen and in the boxes. And my other question was, with the go slower and go faster, who, again, is that going to show up? I didn't try that, but I can go slower. And it does show that I'm asking for someone to go slower, but who else sees that? Is everybody else seeing that?
Okay, so who can see it on the participant screen? I'm going to say go faster.
I can see it on the
Yes, I can.
on the participant screen.
I can see yours, Senator Lyons.
Okay.
And those reactions are those ones are time limited. So I believe they only show up on screen for about like 10 seconds or so, and then they go away.
Okay.
So that one won't show up. Those won't show up forever. They just show up for a period of time.
So, and I don't mean to take up all the time, but if I asked for someone to go slower, for instance, a witness, does the witness see that, or does somebody have to deliver that message to the witness?
The witness would see that, and that's something that we should establish norms.
It actually depends. It depends.
Here's
They
what
don't always see it. And
Here's what I'm going to go ahead, Nolan. Sorry.
I'm sorry. No, I apologize. I was just going to say the thing that also makes a difference is if whether you're using an iPad or a computer, because it's a different interface and there's a different experience. I find that using it on a computer gives you a little bit more capabilities because you have a bigger screen. So that's another thing to keep in mind.
So in terms of the reaction to any of the little emoji things that go up, I will react to those. That'll be the chair's responsibility. Nellie can certainly butt in and say, you are missing something. She does that on she sends me a note from time to time in the chat. So, but in terms of reacting to slower and faster, if it's a witness, that's my job, and I'll do it. Sometimes, if you don't understand what a witness is saying and you want them to slow down, that's really very important. Telling them to speed up, I guess, that I don't know how that works, but that's my job. Nolan, go ahead.
One other comment, and I know this is something Jen brings up a lot when she talks about stuff, and maybe you haven't gotten there, but when you're doing chat, if I'm presenting, for instance, and I'm doing a screen share, I generally can't see the chat or anything. So if somebody's presenting and they're doing a screen share and you're asking questions through chat or raising, they won't see you. So that's something to keep in mind as well.
Right. Oh, yeah. So
And can I
Jen.
add to that as well?
Yeah, go
As
ahead.
somebody who frequently testifies in your committee, if you chat at me or at a witness, or you do a go faster, go slower, it's either or both distracting and also hard to deal with in the moment. So if you put up go slower and I'm reading language to you, I'm not going to see you do it. So I think for our purposes, it may be better to either run things through the chair or otherwise try to get somebody's attention in a more direct way.
I would prefer that no committee member interrupt someone giving testimony unless it's a real critical, I just don't understand what you're saying question. And so that at that point you raise your hand, so let's, I'd like to keep the process flowing through the chair so that we don't end up with anarchy around the table. We know what that's like. So, and we're a small committee, so it's not usually a problem, but just to keep us on the right track in the beginning, and then things do loosen up a little bit here and there. But Josh, you have a question. Senator Terenzini, sorry, go ahead.
So, Senator Lyons, just going back to our committee schedule, I have Wednesday, Thursday, and Fridays times. As I'm new to the Senate here, I'm still trying to learn. Tuesdays will begin at 10:15 every Tuesday, or when we finish on the Senate floor.
Okay, let's circle back to that question. That's a very good question. I'll just announce the time on the Senate floor. If you don't hear an announcement, then assume it's 10 o'clock. Sometimes we don't finish the Senate floor until 11, or 11:15. So it'll just have to be a fluid Tuesday. We'll try for 10. 10 is going to be the time we schedule, but we'll see what happens.
Thank you very much.
You're welcome. All right, back to Zoom.
Yes. So some other quick little just Zoom housekeeping tips. If anybody's going to be joining the meeting via phone, either the senators here or potential witnesses that may be watching out in YouTube land, I just ask that folks share with me the phone number from which they will be calling. With our security protocols, I'm not allowed to admit either phone numbers or names that I don't recognize, just in the way of keeping everything secure. So if you call from a phone number and you haven't told me ahead of time what phone number you're going to be calling from, I have to leave you in the waiting room until you get in touch with me somehow, being like, hey, this is the phone number, this is me. So that's just by way of reminder to everybody. And that's, again, the same with folks joining via computer who their name is not somebody I recognize from the witness list. I just ask that I won't be able to admit you, and I ask that you get in touch with me, and I will get in touch with Senator Lyons to okay you joining. And yeah, because we just like to keep everything very sort of secure and to the folks that are approved to be in these meetings. And that's the same with sharing along any Zoom invites that I send with you. We ask that folks do not forward along Zoom meeting information unless you have got express permission from either the chair directly or from myself, assuming that, because if it's coming from me, you should assume that you have permission from the chair as well. So just do not share along Zoom invites with anybody else.
Go ahead. This is open.
Okay, I had a
Senator
comment.
Hardy.
I had a comment and a question. first of all, having been in a committee last year that was Zoom bombed in the Ag Committee, it's incredibly disturbing and just awful. So I just please remember what Nellie just said and don't share Zoom links, because it's really bad to be Zoom bombed and makes you feel awful for the rest of the week. And Nellie, a question for you. Are you going to be sending us the Zoom invite on a daily basis, a weekly? How is that going to work? Every committee assistant does it a little differently.
Yes, so normally my process is Friday, I will send out the invites for the week, for the following week, and then daily in the mornings ahead of the committee meetings, I send an email to everyone being like, hey, this is your Zoom info for today, just to make sure that everyone has got the proper info for that particular day, and we don't end up with somebody who's in the meeting for tomorrow on today, or the meeting from yesterday on today, anything like that. So you should be on the lookout from me for weekly calendar invites, and then daily as well, emails with the Zoom info.
No excuse for missing it, unfortunately. Senator Hooker.
I'm just wondering if we should all send Nellie our main phone number in case for some reason we're on the phone. So
I think, well, yeah, I think Nellie, you were going to work on a list anyway of communications lists.
Mm-hmm.
We've done that in the past, so yeah.
Yeah, I mean, getting phone numbers from the committee members, I think would be useful, because we have in the past run into issues where, and it has happened to me as well, where your internet burps out and you need to be able to get back into the meeting. So I think if senators on here could send me their phone number that they might potentially be joining the meeting from, so that I don't have to be hustling around in the background being like, is this number a senator, or is this just like somebody? So that would be useful, Senator Hooker. Yes.
And with people who are outside of the meeting, witnesses, potential witnesses and stuff, how will they contact you, Nellie, to let them know? I mean, you obviously will be in contact with them prior to the meetings, but you'll have an email address that they can get to, or a phone number that they can call, so that if you
It's on
don't,
our webpage.
Yes. Yeah. My email address is on our webpage. So if anyone needs, it's also on the agenda. So if anyone needs to get a hold of me, my email address is on there.
So, so we haven't talked about witnesses and witness process yet. Let's hold that thought, because it's not different from what we would do were we in the State House. But I just want to have us all feel comfortable with Nellie's ideas and our process on Zoom first. So let's do that first, and then we will get to the other part. Any other Zoom issues? I will have Zoom issues that we will discuss as we start working on bills. And some of the things that you probably should be thinking about, that I think about all the time, is as we write bills and we make decisions about bills, we get to a final iteration, a final draft. And then we think we're all done. And we post the draft. And then we start hearing from people that we want that section or this section or those words changed. So we're going to have to be very considerate of our process, and when we get to a final, when we can make that final vote, and knowing that, of course, we want to listen to changes that might come up after we have that final draft. There's no question about it. But we probably won't be taking full testimony on that final draft. This is something that I've been thinking about quite a bit. So we'll come back. I just want to come back to this just as an alert that we want to make sure we can finish our bills in with good time, and that we don't prolong the agony of decision making too much. But we don't want to close people out from helping us with information. So that's just that's just a heads up on that particular issue. And as I said, this is something we will come back to a broader list of Zoom issues related to our testimony and to our bill making as we go forward. So, just some thoughts there. Any other thoughts you guys have on Zoom? I mean, we've all had experiences. I mean, and I liked, Senator Hardy, your comment on Zoom bombing, because I was Zoom bombed on the floor, which wasn't fun. Anybody else? Josh, I don't know what your experience is in your personal or professional life with Zoom, if you have any concerns or questions.
Well, Senator, thanks for asking. I have quite a bit of experience with Zoom. My previous position, I was chairman of the select board in Rutland Town, and we last March switched to Zoom. So for the last 10 months or so, I was hosting a biweekly meeting on there. Unfortunately, we too were Zoom bombed by a group of 6 or 7 that entered, and it was very unpleasant and interrupted our meeting. So I appreciate all the security measures we take here, and so thanks for asking. Okay,
well, that's good. I'm glad to know that you've got some experience with it, because it does make a difference. Anyone else? Nellie, is there anything else we need to cover at this point?
Just one quick last thing. I just want to flag to everybody that the chat function in Zoom is public. So anything that you put into the chat box, you should assume is being broadcast over YouTube. So just be mindful of that.
Okay. Okay, are we good with that for now? This is going to be our never-ending problem, right? So let's do this. We have an hour left, but I don't know. It might take an hour. Who knows? I would like for each of you, as much as we can today, to just give me a list, and we can do this today and we'll come back to it again tomorrow, but just your preliminary thoughts on what issues in health and welfare are key and important to you and your constituents, and that we should be working on together as a committee. So let's go around the table again. And this time I'm going to start with Senator Hardy.
Ooh.
That's you.
Okay. Well, as I said before, thank you, Madam Chair. As I said before, obviously, I think everybody's first priority is the pandemic and our response to that. I've gotten, as I'm sure all of you have, inundated with questions about the vaccine protocols and schedule and order and information. And I have particular concerns because a number of our long-term care facilities have yet to receive vaccinations, and yet other people are receiving vaccinations. So that's a particular concern that I have, that I'm guessing most of us share, just that very vulnerable people who have been in isolation for a long time and need to be vaccinated. And then just sort of recovering from the pandemic, talking about lessons that we've learned and how we can make our healthcare system more sustainable. I'm excited that we have a new incoming administration at the federal level, and I'm hoping that means that we'll be able to work more going forward after the pandemic with some healthcare reform issues. And hoping that we get into a conversation at some point down the road about the accountable care organizations and sort of the big picture. And I will need a lot of, I think, information and reminders and updated information from Jen and Katie and Nolan and others about the situation. Childcare is a huge priority of mine and another thing that we saw and during the pandemic that needs attention. And I'm glad this committee has a broad jurisdiction and can work on childcare as well. And then food security. This is an issue I worked on in the Agriculture Committee. It's again something we saw during the pandemic as a huge issue in our state. So focusing on how can we ensure better food security moving forward, particularly for children and seniors, but also some other populations that may not be as obvious, such as young adults who are in college, or young adults who are just suddenly on their own and may not have access to food as much as they need. The mental health issues and substance use and prevention are other issues that are important to me and my constituents. The opioid crisis is still a reality in our state, so wanting to get back to talking about that as well. So those are the top of my head issues. I'm sure I'll think of others and you'll bring up others that I'll be like, yes, that too. They're just a lot of issues, but those are the top of my head issues. Thank you.
Those are all terrific issues, and there are things I think that we have on our list. So this is great. I think some of the issues that you've identified will begin to be at least identified and clearer as we go through the testimony this week and next week. So this week is what's happened in the past with CRF, and certainly not complete yet. But then next week, we'll also look at the new funding that's coming from the federal government and the guidance for that. So, oh, well, that we have just a couple things to do. This is great. Senator Hooker, you're next.
Thank you. Thank you, Madam Chair. And thank you, Senator Hardy. You brought up many of the issues that I know that we're all thinking about. I do want to just mention workforce development again, especially in the healthcare arena. We are seriously understaffed in many areas, and especially in primary care and in nursing, and certainly in assisted living facilities and nursing homes. We really need to work on beefing that up as much as we can. And then again, going back to economic development, housing, I think, is fundamental to good health. And so we need to deal with that as well. Certainly healthcare reform in any way we can do, whatever we can do to move ahead to make sure that we have cost-effective and effective healthcare in this state, that we're getting the best bang for the buck, and we need to look at that seriously. So those are just a few to add, and I think we have a full agenda here, but go ahead, the rest of you can add things too.
All right, Senator Cummings.
I got 3 screens and 2 mice and several other things going here. Okay, all of the aforementioned recovery, workforce, childcare and broadband have come out as the 2 big lacks that we now know are economic necessities in the state. Along with that, I'm concerned about the growing consolidation in healthcare and the possible impacts of that on pricing primarily, and perhaps availability, and whether or not we have chosen the correct way to deal with that as we try and move forward with healthcare reform. I'm hoping maybe we'll see something coming out of DC that might keep us from feeling so alone in that area. But I think that consolidation is probably what I'd add.
Okay, thank you. I hear that a lot, and I just read an article about that again. So there are several articles that I may, time permitting, I'll try and share with you articles as I get them, and that we can look at together. Not right away. It's not time for that, but when we start getting down the road toward reform issues. Senator Terenzini.
Well, thank you. Several topics I was going to mention, my colleagues in the committee have already highlighted, but I have a few. First and foremost, priority number one universally has to be supporting good legislation that's going to help support our state come out of this COVID pandemic. The vaccine deployment and monitoring that and seeing what we can do to help get the vaccine out to as many people as quickly as possible who wish to receive it. Supporting our hospitals. I think that our hospitals have faced unprecedented budget shortfalls and certainly struggles over the last 10 months or 11 months. And I think it's important that I, as a committee member, do everything that I can to support our great Vermont hospitals. In fact, I know Senator Hooker and I have a good relationship with the CEO of the Rutland Regional Medical Center who reached out to us and was excited to see we were both on this committee.
That's a Rutland takeover.
Yeah, that's right. We're also on education together in the afternoon. So it really is a health and welfare and education. It's a Rutland committee, it seems. Two others that I wrote down, three others, I'm sorry. Nursing shortage. We heard about this loud and clear that our hospitals are struggling to staff, especially with nurses. A lot of our young adults go away to college out of state and for nursing, and then those regional hospitals in the area of their college gobble up the nurses, and they never have the opportunity, or we never have the opportunity for them to come back. So with Castleton University here and other colleges offering nursing, it's something that I want to be a big part of supporting and filling those vacancies. Prescription drug costs are still too high, in my opinion, in many areas. And the last thing is mental health access. This virus has really highlighted the fact that some people have mental health issues, and it's not something that people talk about. There's a stigma certainly around mental health still. You hear often people talk about physical ailments, heart conditions, and cancers, and so on, but people are not always as willing to talk about mental health, and I think that's something that has gotten worse here with social distancing and confinement to our homes and so on for many Vermonters. So making sure that we have access to good mental health for our friends and neighbors is important. So a lot I just threw at you, a lot of good discussions I'm sure we'll have, but those are some of the thoughts that I had to start the day with.
Just a few issues that we all have. And can I congratulate you on your thoughtfulness, because I think each one of you has identified really key issues for us going forward. I would like to, maybe I can give you some of my thoughts. I don't know if you'd like that or not, but I think I will. So absolutely, the pandemic is a priority. That's a Senate priority overall. I think it's a legislative priority overall. And where we have been, how we identify the gaps and the needs that are existent, what system issues have been opened up. So the gaps in the system are what we should be thinking about at a policy level. And what can we do to improve the system going forward? With that in mind, of course, then you automatically look at some of the things that you've talked about. Childcare, there's a huge gap in having a systematic approach to childcare in our state. Some of that was a little bit addressed with the hubs that were put out, but we don't have that comprehensive system. I know that There will be discussion between Senate Health and Welfare and Senate Education on that particular issue and how we can really firm up our system of care for kids. Part of that for me is really the role that business plays in this. And since the childcare is just fundamental to having workers in place and to being a part of the workforce, that I really do hope, and I think we will hear testimony, depending on where the bill starts, we will hear testimony around the child care bill coming from folks in the business community. Right now, and just to give you the heads up on that bill, it is a bill that I have asked to have introduced. Katie and I are finalizing it with trying to reach out to the administration to get some information from them. And after I was asked to introduce the bill, it was also folks in the House were asked to introduce the bill. So now we're working on where it goes and who starts it and so on. But that doesn't limit us to our thinking and how we might contribute to the final child care system approach. Next week, we're going to start looking at how we use the next tranche. I don't like that word, but the next money that comes from the federal government. And we'll do that. And then, of course, that is COVID related use, but it can help with so much of what we're seeing in terms of people being left aside for mental health or substance use disorder issues. One of the things that I hear very clearly from my healthcare friends is how important it will be to integrate healthcare and mental health support into the school system. And that can be by Zoom, by remote. It can also be in person. So those are those are tricky questions to ask and to answer because it involves other committees and other agencies working together, which is something we all would like to see. In terms of healthcare reform, just so you know, that's one of the things that I've been working on for a long time. Healthcare reform has certain barriers that sort of disallows us from accomplishing the goals that we'd like. But I see with the federal government changing, and I also see with some of the reports that we're going to get back and some of the work that we've done on transparency of cost pricing, of pricing for medical services, with reports back on equitable reimbursement for providers. I mean, those things all sound like little things, but in reality, they, if we can change some of the little things, we are going to see some huge steps toward reform efforts that provide for more cost-effective, affordable healthcare. And the access piece is so critical. So healthcare reform for me is a super top priority, and it will continue to be. I talk with people almost on a daily basis about where they are with the Green Mountain Care Board, our hospitals, and our long-term care facilities, our DAs, our SSAs, all those folks who are integral to acute and chronic services. So our job is going to continue to be important, fun. I look at it as, I enjoy doing this, and I hope that you will too. So, so then as we work on the pandemic and we're identifying issues, we also had some bills last session, just to get down to the bill level. We had some bills last session that were stopped either in the Senate or in the House and never really had a full vetting. So they never made it through all the way. One of those I think you probably all are interested in, and that is the Nurse Compact, which is a workforce development bill. So I've asked to have that reintroduced. And I apologize if, look, I've introduced a lot of bills. If your name isn't on those bills and you really have a strong interest in that, we'll see what we can do to fix that. But I think that whatever we pass comes from the committee. It has your name on it. You support it. You worked on it. It's not whoever introduces a bill for me, opens up a conversation. The ownership of the issue is not one person. It's all of us together. And eventually it becomes a huge group of people in the House and in the Senate. So I think, and we can all take comfort in that the bills that we pass out of here have some meaning to our colleagues in the House and Senate, but also to our constituents. So Nurse Compact Bill, we also passed a bill on PFAS, that the chemical that is we have found in our groundwater and can cause public health problems. So that bill will also be, we'll send that one back over to the Senate. It never made it out of Human Services because of COVID. We also have a bill on vaping and flavored smoking product, and we'll look at that bill together again. It ended up in finance, and so we will take some time to have testimony on that and hopefully get it back to finance, and then out of the Senate. So there are other bills that we've had, and I've asked to have some of those reintroduced. There's stem cell therapy. I'm trying to remember all of the others, but those are some key bills that we need to look at. I do understand that for those of you who have not been on health and welfare, that a lot has happened over the past several years that has changed. The Green Mountain Care Board has changed, and the role the Green Mountain Care Board should or is playing, the role of the Accountable Care Organization and what that is, and how it works, the role that hospitals play along with our designated agencies. So there's a lot of work that we have done that I think we're going to have to review a little bit. And so to that end, I think Katie and Jen and Nolan will be bringing us reports on some of the reports we've asked for, and then let us know what reports are coming up so that we can understand where we are as we make decisions. So I think that's enough for now. I think for me, this committee is, covers the globe. We hold the population together. And for me, when you look at public health, just picking up public health, not just healthcare, but a population-based perspective, a public health perspective is so important. Public health is fundamental to a rich economy. It's fundamental to a healthy population. So I look forward to working with each of you. Each of your ideas sound terrific. So we'll see what we can do. You keep me posted on the bills that you have and you want to take up, and we'll work together. And I see Senator Hardy, you had your hand up.
Yeah, thank you, Senator Lyons. Just two issues that didn't get mentioned that I wanted to mention is a couple of years ago, my first year in the Senate, I worked on a bill. It was the only bill that I was the primary sponsor on about dental health. Mm-hmm. And I worked with Jen and Nolan on that. So I would, when we have time, just an update on the sort of status of that initiative and the landscape of dental health, particularly following COVID. Anybody who's been to the dentist during the pandemic knows that it's a little bit different than normal, like everything is. But so just wanting to sort of circle back to dental health. And then hoping that within all of the work that we do, that we sort of infuse a lens of equity, writ large, but particularly racial and ethnic equity and access to healthcare and public health planning. I couldn't agree more, Senator Lyons, with your lens about public health. And I think hopefully this pandemic has shown for everyone the importance of having a very robust public health system and how important it is during times of emergency. So.
Thank you for those comments. I think they're right on target. In particular, we do want to focus on dental. There also will be a hearing aid bill. So those two areas are sort of a taboo on coverage. So we'll need to look at those. And then your comment on the lens of equity and diversity is also critically important. As a committee, we did ask the Department of Health to keep racial, ethnic, and other categories of and data during the pandemic. And we need to keep overlaying that, not just with the pandemic, but going forward. You're so right on that. I don't know. Let's see. There's one other thing that I didn't mention. I think is important. That this committee started to draft a committee bill last year. Senator Cummings will remember. It's a committee bill on planning, future planning for health emergencies. Yeah, so if you look, and maybe it's changed, but if you looked at our hazard mitigation, our emergency planning plan, our plan for the state, healthcare is about at the bottom of the list. And as we all know, no one anticipated this. No one anticipated being sequestered in quarantine or being socially distanced, wearing masks. That was not part of our culture and our society. And we didn't have an understanding of the systems that we would have to have in place, whether it was economic development or public health agency at the local level, any of it. So I do have a bill that is a continuation of the draft work we did last year that will help initiate statewide planning for a health emergency. It's not a complex little critter, but it's a start. I'm going to try to bring it up with the chairs at the chairs meeting this afternoon. If chairs want to sign on to it, that'll be good, because I do think it fits with every single committee in the House and the Senate. So we'll just see how that goes. And then finally, last word on broadband. Broadband, we can't function without broadband right now, and we need to make sure that we have it accessible to us. Anyway, okay, well, any other comments? What else did we forget? People. It's all about taking care of our constituents. Yes, sir, Senator Terenzini.
Well, I appreciate that you mentioned broadband, and I didn't know which sort of committee bucket that fell within, as I'm still trying to learn and navigate the Senate waters here. But that was one of the real reasons I ran for the Senate, was the lack of acceptable broadband and cell phone service. And I'm excited to hear you mention that, because that's, to me, it should be a bipartisan issue for the most part. I mean, that to me is as simple as in 2021 having running water and electricity and heat in your house. I mean, it's the way of the world, and there's far too many places in this great state that we see unacceptable coverage. So I appreciate you mentioning that.
So I just want to say that Senator Cummings also mentioned it, because it is in her jurisdiction, in her committee in finance. And go ahead, Senator.
My apologies, I didn't hear you.
No, that's
Senator
okay.
Cummings.
We don't hear a lot when we're sitting here.
And it is very bipartisan. Senator Brock is one of the leaders in our committee. So all we need is a little something like $300 million. So if we can find a bipartisan way to raise that, we're good.
Oh,
Okay, so I
Good.
know there's some businesses, national, international businesses that could just help float a grant.
Might
So-
try
yeah.
that.
They gave it all to the food bank.
Well, that's a good cause.
Yeah, it is. I know. I'm not disagreeing with it. Go ahead.
Just to go back to the racial equity and ethnic considerations, I think in last session, migrant workers were kind of left out a little. And in our healthcare discussions, I think we really need to make sure that they're taken care of and addressed, as well as refugees. I mean, a lot of small issues like translators or seemingly small issues. Those are the types of things that can really help new citizens to navigate the healthcare waters.
You're right. I do know that in the new money that's coming to us in the in sort of the vaccine section, the public health section of the federal bill, there's a significant amount of money that's coming to Vermont that can be used for educational purposes and helping folks who don't speak English as a second language or not at all. So maybe we can look at that a little bit together and how we might advise the Department of Health about that. I do know there's the free clinic that we have is the clinic that can provide services to undocumented folks. And we can't give directly in that case, but we can ensure that where they're taken care of, that those places have support. So those are the kinds of things we'll have to navigate through. But very good point. Really good point. Just one last thing on the broadband piece. Telehealth and telemedicine are absolutely key to us, and they will continue to be that way. Our committee has done a great deal of work in that area, and so we'll continue to do that. For me, the biggest problem that we have around broadband and the expansion of that communication system is it's seen as a trade commodity rather than a communications commodity at the federal level. So the whole problem is it's regulated through the FTC and not the FCC. And I'm thinking of all these little things that should or could happen at the federal level that would improve outcomes for our state in that area. So that's Senator Cummings' domain. I'm going to let her run with that one.
I just made a note.
Okay. Okay. Anything else? Katie, Jen, Nellie, Nolan, anything?
We need to choose a clerk for the committee.
Oh dear. That's a good idea. So the clerk is the person who keeps track of votes when we vote on a bill. And the clerk makes sure that the witness list for each bill is provided to the person reporting the bill up on the floor. And the clerk is the person who actually calls the roll and takes the vote after we have finished work on a bill. So, are there any thoughts and nomination for clerk? Is there anyone is there anyone who wants to be clerk first?
Cheryl, go for it.
I nominated Senator Terenzini. He's shaking his head.
Which way? Which way is he shaking his head?
left to right.
Senator Terenzini.
Every I've been on where I was the new member, I've been the clerk. So.
It's an honor to be the clerk. It is.
I was going to suggest
given to new
Senator
members.
Hardy, but
Oh, she's already vice chair.
I'm vice
Oh,
chair.
Yep, she can't do both.
Okay, well, I'd be certainly, I will serve at the committee's pleasure. So if Senator Hooker feels that I'm worthy of that job, I'll certainly accept. So
Definitely worthy.
Are there any other nominations for clerk? All right. So all those in favor of Senator Terenzini as clerk, please say aye.
Hi.
Aye.
Aye. Any opposed? Senator Terenzini, did you vote?
I was thinking about saying no, but I would have lost anyway. Aye.
All right, terrific. Okay, thank you for that. And your job is pretty, doesn't really begin until we have a bill that
Okay.
we pass out of committee, and I'm happy to chat with you if you'd like to at some point. So,
All right. Thank you.
all right. Thank you. Any other business that we missed? So we meet tomorrow at 9. I'll try and put an informal agenda together for us for tomorrow, and then and actually Nolan or Katie or Jen, if you have some thoughts for tomorrow morning at 9, that would be helpful. I'm thinking of the acronym list,
I don't.
or Jen.
Well, let me frame it. I have an acronym list, but it hasn't been updated in a few years, so it's
Okay.
really too much. But
Okay. All right. We'll start with that.
I have
but-
ideas. We can talk offline.
All right, that's good. And Jen and Katie similarly. I'm thinking also of maybe an overview of what our responsibilities are. So we will fill our time, not to worry. So 9 o'clock tomorrow morning, and have a good rest of your day. I think that's it.
Thank you.
Take care.